Peripheral nerve injury or the neuropathies can be described by several classification systems. According to pathology, we have two major types of neuropathies: axonal neuropathies and demyelinating neuropathies. In axonal neuropathy, there is a direct injury to the axon and the entire distal portion of an affected neuron degenerates. The degeneration to the proximal portion is just limited to the next node of Ranvier. Following the degeneration of axon, there occurs loss to myelin, and the process is well described under the heading Wallerian degeneration, where the regeneration takes place through the axonal regrowth and subsequent remyelination of the distal axon. This you must have studied in your physiology classes, and if you have not studied, I would well advise you to go through the topic of Wallerian degeneration once again. The demyelinating neuropathies are characterized by the damage to the Schwann cell and the myelin with relative sparing of axonal processes. That means in the beginning there is no damage to the axon, only the myelin sheaths are damaged. And this gives rise to abnormally slow nerve conduction velocities. That means the nerve conduction is not completely stopped, rather it has become very slow. Now you can see here the three major types of axonal neuropathies. The grade 1 is known as neuropraxia, where there is a compression of the neuron, there is no actual damage. Grade 2 is the axonotomosis, where there is a direct injury to the axons. And the third category is the neurotomosis, where there is a complete destruction of the axons. So now this neurotomosis can run through three patterns: one in which the sheaths are intact, the axons are destroyed; the second one, grade 4 neurotomosis, where there is a destruction of the neurons and its myelin sheath; and the grade 4 neurotomosis, where there is a complete severance of the nerve. So we have three grades of three types of axonal neuropathies: neuropraxia, axonotomosis, and neurotomosis. Another way of describing the peripheral nerve injury is according to anatomical involvement. Which part of the system which kind of neurons are affected? Sensory neuropathy, the damage is restricted to the sensory neurons. Motor neuropathy, the damage to motor neuron. Autonomic neuropathy, damage to autonomic fibers. And mixed neuropathy, there is involvement of all the three types of axons. In heartbeat zoster, there is a typical damage to the sensory neuron, so only complaint of the patient is pain. Polio, well, it cannot actually be described under the neuropathy because here the damage is to the interior horn cell of the spinal cord, but it ultimately produces the degeneration of the entire motor neuron. So in polio, there is no sensory deficit, there is only motor weakness. Diabetes is known to produce damage to the autonomic fibers. In leprosy, we can see the involvement of all three types of the nerves. If we look at the number and the symmetry pattern, we can have polyneuropathies and mononeuropathies. Now, polyneuropathy, it affects, as the name suggests, poly means many. So polyneuropathy is involvement of many nerves. and mononeuropathy is involvement of only a single nerve. But this involvement of many nerves can have a pattern. In polyneuropathy, the involvement of nerve is in a symmetrical manner. It is more pronounced in the distal segment of the long nerves, and one can have a stocking and glove sensation. Stocking means giraffe, glove means glove. So here is a symmetrical involvement. On the other hand, when many nerves are affected but there is no symmetry, means the same side of nerve is not affected, then it is known as polyneuritis multiplex. Here the damage randomly affects the portion of individual nerves. So as per the number and symmetry pattern, we have three patterns: polyneuropathy, polyneuritis multiplex, and mononeuropathies. In the next lecture, we will talk about the etiology of the peripheral nerve injury.